How many minutes are there in a year? Did you know that it is the same number of heart attack deaths per year in the United States alone? 525,600. That's right, one person in the US dies of a heart attack every minute. Now, one of those was my dad, who died of his second heart attack in 2006. So I have a personal interest in cardiovascular health, which has driven me to attain the highest levels of knowledge and excellence I can to help my patients and colleagues. It's too late for my dad, but it's not too late to help those in our families and the patients in your practice and mine. Now, cardiovascular conditions are the #1 cause of death in the world, affecting 1 in 3 adult Americans, and there are some 850,000 deaths per year in the United States alone. And the most common cause of death, did you know? Blood clots. Imagine that. If you and I can show patients how to naturally prevent blood clots, we can help prevent perhaps half of all health issues and premature death. Now, for most patients, cardiovascular conditions are one form of metabolic syndrome, which includes 70% of US adults and is caused by insulin resistance. In fact, it's also known as cardiometabolic syndrome. So what can we do? Can we actually help our families and patients to promote cardiovascular health naturally? Or do we just need to take drugs for life to lower cholesterol and manage symptoms? Does high blood cholesterol really cause heart attack and stroke? Is 140/90 really the upper limit for blood pressure? Is there any way to safely prevent blood clots, which cause most heart attack and stroke? Is there an autoimmune component to some patients who have cardiovascular conditions? Now, in this seminar, the cardiovascular seminar, you will get answers to these and other questions from my 28 years of clinical experience. Here's some of what you're going to learn in the cardiovascular seminar. One is you're going to learn the truth about cholesterol and blood pressure and what are the real contributors to cardiovascular concerns. You're going to learn the 10 most important laboratory tests for assessing cardiovascular risk, and you'll learn the 10 most powerful foods, lifestyle changes, and food and plant-based supplements that really work and, unlike drugs, are safe. Now, because of how common cardiovascular concerns are, this is one of the most important and practical seminars you can take. What you will learn will help you improve cardiovascular health in your patients and community, promoting quality of life and reducing suffering for perhaps thousands of people. So we'll see you there.